Thank you for joining us and welcome to the 18th Community Wellness Roundtable. We have a playlist on our RCMI YouTube page where you can view our other wellness conversations about COVID linked in the chat. This call is being recorded for posting on the Howard University RCMI YouTube channel.
Good evening, everyone, and welcome to the third Community Wellness Roundtable of 2023. My name is Lonnisha Barrientos, a Community Engagement Specialist with the Research Centers in Minority Institutions, or RCMI, program here at Howard University College of Medicine. If this is your first time joining us, welcome. I am your host for this evening, joined by my colleagues, Ms. Kristen Holmes, Ms. Karen Parker, and Dr. Carla Williams. Again, we want to remind you that this call is being recorded. I'll hand it over to Kristen to share a little bit of what we do here at RCMI. Kristen?
Thank you, Lonnisha, and good evening, everyone. My name is Kristen Holmes, and I am a Community Engagement Specialist on our team. Our RCMI program focuses on enhancing and developing the necessary research infrastructure that ensures Howard University's ability to contribute to the resolution of diseases that disproportionately affect underserved and minority populations. Our group, the Community Engagement Corps' primary goal is to ensure that RCMI-supported research addresses the needs and interests of our local community. To achieve this, we do three things. We partner with local community organizations to address health-related concerns, promotes community participation in research and partnership with researchers in study design and execution, and we ensure research findings are shared with relevant communities. That's why tonight's conversation with you is critical to our work. This core is led by Dr. Carla Williams. Thank you so much for being here.
Thank you so much, Kristen. I will then hand it over to our director, Dr. Carla Williams, to share a quick insight on why we do what we do, which is to increase research literacy in our communities. Over to you, Dr. Williams.
Thank you, Lonnisha and Kristen and team. And let me add my welcome this evening and my thanks to our expert speakers tonight. So tonight you'll be hearing from some trusted sources of information on this topic, but we know that throughout our daily lives, we're exposed to information from multiple sources. And one of our goals is to make sure that when people encounter information via the media, the internet, social media, that you're able to assess it for yourself and determine how you want to use that information to inform your health and your health decisions. So in making those types of informed decisions, there's 6 things that you can consider. So as you're listening tonight, listen in for the 1 or 2 items from this list that might be most important to you. So when you receive or get exposed to information that's derived from research or someone is expressing an opinion, some things you can ask yourself are, number 1, does this really represent people like me or those that I care about? Another question that you might ask is, how relevant is this research and information to my personal life? Some more nuanced questions that you might ask are, was this data or information derived from a source that was really done in an ethical way, what we call regulation? Were the people who participated or gave information adequately protected? That's something that you may want to know to understand the ethics of the people conducting the research. Another question that you might want to ask is, who actually reviewed the information to make sure that it was accurate and informative? And then the last couple of questions that you might want to ask yourself are, could this information be repeated, or as we call it, replicated, if you try to do the research again? And then ultimately, that leads to whether or not the research is what we call rigorous. And that's the most important question that you might want to pay attention to, because we want to make sure that our research represents results that are real and meaningful and can be relied upon. So again, tonight you'll hear from speakers that we find are very trusted sources of information. Again, listen in for the factors that might be important to you. And hopefully you can carry this information with you as you're navigating the media that you're exposed to every day. Again, thank you for being here.
Thank you so much, Dr. Williams. I will hand it over to Kristen before we begin.
Thank you, Elisha and Dr. Williams. Before we introduce our speakers, we do want to make this disclaimer. This event is not a substitution for meeting with a mental health professional. Please contact a healthcare provider for a referral to a licensed mental health counselor. For emergency mental health needs, please call the number 988. Thank you. Over to you, Elisha.
Thank you so much, Kristen. We are really glad that each of you has taken the time to join us tonight. If you are just now joining us, welcome. We are Howard University Research Centers and Minority Institutions Community Engagement Corps, or in short, RCMI CEC. We focus on research engagement with our local community and our community wellness roundtable discussions, which you are here tonight joining us, serve as a way to bridge the local community with the research community. Now on to our speakers. Our first guest this evening is Ms. Lonnisha Lewis. Ms. Lewis is a mental health psychosocial support specialist at Washington Health Institute, and she has previously worked as a community support worker. Thank you, Ms. Lewis, for joining us this evening.
Hello, everyone. First off, I want to say thank you for having me. So today, we will start with our children and youth mental health. Okay. So first thing first, I would like to say I am extremely nervous, so forgive me if my voice is shaky right now, okay? So once again, so now I will start off with the presentation after that disclaimer. First, I would like to say it's difficult to talk about mental health when there are so many avenues that influences a person, all right? So children, when they're young, they begin to gather information within their surroundings, and they start to practice that behavior, that learned behavior from their household, from their community, as well as current politics that are happening. For example, the household that I grew up in, we were always told a child is supposed to be seen and not heard, right? So I'm not sure how many of you have been told this as a child. I'm from the South, so that's probably where this came about, but did you know, by you telling a child this, by you basically discouraging them to cry or to remain silent when they're trying to communicate, this is a form of emotional neglect. No one speaks about this. I've never heard of this until I've gotten into this field and I've gotten like this aha moment. But it's true. Not only are we disallowing a child to become their healthy, well-being self, but we're also stunting their emotional intelligence, as well as their communication, and for them to have a voice later on as they become an adult. Right. I am unable to see the crowd right now, but just think about this, all right? So, what didn't you like about your caregivers' parenting style when you was a child? Okay. And how many are you now are actually using this technique, this learned behavior with a child underneath your care? So once again, this is one of those things when we have these experiences and somehow they shape our outlook. We start to use the exact same behavior that we didn't like that was used towards us that we are now using to our children. Okay. So mental health. Well, first off, I would like to say mental health and mental disorder, although they're used interchangeably, there are actually two different terms, all right? So mental health is, well, I'm going to give you my definition. I've written it down. Okay. So mental health, as defined by me, is a component of the overall well-being that drives our intentions and abilities to make decisions. Okay. Mental disorder is a disruption. It's a clinical, my apologies, a clinical disturbance in our mental health. So when it comes to mental health, it's our psychological, emotional, as well as social being. So all of these components, whenever there's an issue with one, it shakes our mental health in a sense, all right? Mental health is inclusionary. It does not discriminate. Everyone has a mental health. But this is the thing, it shifts. It shifts depending upon the circumstances and the experience that you've gone through. For example, race, right? Sexual orientation, disability, ethnicity, class, meaning income, the money that we have in our pockets, fairness of skin. All of these experiences have a way to eventually, once again, just change our mental health. All right. So there are a few factors. I'm sorry, could you change it? Thank you. There are a few factors that influence a person's mental health. So we have genetics. Genetics meaning a child that is related to a person that has a mental disorder, they are more likely to receive one, or at least to manifest a disorder later on in life, due to stress, due to genetics, things of that nature, as well as the environment. For example, police surveillance, poverty, things of this nature as well. It can affect someone's mental health. Let's take, for example, when the social unrest was happening as well during COVID-19. So, but we're going to get into the stats later on, but I just want you guys to keep that in mind, how they can impact someone's mental health, all right? If someone is hungry, if a child is hungry, they're unable to, okay, I'm sorry, I was reading the note, okay? So as a young person, if they're in school, right? And if they're hungry, they're not really focusing on creating those healthy relationships. And when it comes to crime as well, for the most part, when it comes to crime, persons, they're not really thinking about the consequences. They're thinking about really just getting something to eat at that time. So they may steal something. I'm not condoning the action. I'm just stating the facts. Would you rather be hungry, or would you rather want some money? I mean, would you rather be hungry and just think about here and now, or would you think about the future? Okay. Childhood experiences when it comes to trauma, molestation, grief, abuse, all of these as well can impact the child's mental health. Okay. So we're going to go to the stats right now, to the statistics. I've gotten a few from basically the children regarding COVID. I'm sorry, I cannot read that, but please take your time and read this for me, this page, and then we'll flip it in a minute. Okay. And some more statistics. Thank you. Okay. So possible influences, okay, to the elevated emergency department mental health visits. So once again, it is fear of infections, disruption of structured daily lives, social isolation, and also parental mental health difficulties. Okay. Okay. And please just read these stats as well, these statistics.
Lonnisha, I will read out loud the
Thank
slide
you.
for those who aren't able to see it. So for the first one, it says 11% experience physical abuse by a parent or other adult in the home, including hitting, beating, kicking, or physical hurting the student.
Mhm.
More than half, 55%, reported they experienced emotional abuse by a parent or other adult in the home, including swearing at, insulting, or putting down the student. And lastly, more than a quarter, 29%, reported a parent or other adult in their home lost a job.
Thank you. And please, okay. So this is the social development stages. It was created by a theorist, a social theorist. His name is Eric Erickson. So this is what this is from. So according to Erickson, these are the healthy development stages for our children, all right? So from newborn to one, they should be building a trust with their caregiver. And if they fail to do so, yes, if they're unable to do so because if they are unsuccessful, it is they will begin to have distrust and as well as have a sense of fear about the world. Okay. Age 1 through 3, the child asserts independence by distancing self from their caregiver, and they begin practicing choices as well. For example, what do I eat? Mom, I want to wear this. Now I would like this, things of that nature. And if for whatever reason a child is unable to basically express their wants, their desires at this time, and if they're criticized by their caregiver or if their caregiver is overly controlling, the child will have a sense of inadequacy regarding their survival skills, and they become dependent upon others, basically becoming followers. Say, I wasn't done yet. Okay, yes, so 3. Okay, yes, for 3, so age 3 to 6, the child begins to assert themselves often. They begin to plan activities, initiate games with others, and if they aren't able to do this, the child begins to feel they are a burden to others. Okay. Age 6 to puberty, this is when the child begins to develop sense of pride in their accomplishments. And if for whatever reason, once again, they're unable to, the child begins to feel inferior. They begin to doubt their abilities. So adolescents, they begin to look for future in their terms of career, relationships, family, housing, etc. And they start to develop also this sense of identity. So if the child fails to accomplish this task, there's a sense of confusion about self or their role of the world that they are in. So although this is like a blueprint of a sense regarding development stages, it's natural for a child to skip, building trust with a caregiver and skip to age 3 to 6, asserting oneself and going backwards. So there's really no right or wrong way. Some people also, they develop these skills later on in life. Someone could be 30 and they'll finally begin to have a sense of their pride and accomplishments. Okay, so we are next. So if you need help, please get help, okay? And these are some of the resources that I found that I hope will assist. Okay, so we have Mary Center. They are for children, and they have children and teen services. They also help the child become connected to public benefits as far as Medicaid and Medicare if they do not have insurance, so it's fine. They also accept Medicaid and Medicare, or they have a discounted price, and the phone number is 202-483-8196. Another thing that I can do is, if you guys are interested in the resources, please contact me. I believe my email was on the first slide. If not, I can give you my email and I can send over the resources for you, or I'm sure the committee as well over Howard will be able to send you over the resources that I have regarding mental health services.
Yes, we will have a follow-up email with all the resources that are on here, as well as your contact, Lonnisha.
Thank you, you guys. In our summary, some of the things that we have learned. Okay. So, I'm sorry, can I see it? Okay. 1 second, please forgive me, you guys. Okay. So mental health and mental disorders, they are different. The data show the negative effects of COVID-19 pandemic on children and youth mental health. Children and youth are developing their sense of identity during a uniquely difficult period. If you need help, we highly encourage you to seek professional help. We will relay you the resources that can assist you. And thank you everyone for hearing me.
Thank you so much, Ms. Lewis, for sharing your knowledge and your expertise with us. I will look in the chat now to see if there are any questions. If someone wants to ask Ms. Lewis a question, please feel free to raise your hand, and so you can come off mute and ask her. Some comments that I have been reading. Someone said, Miss Maria Aviles said, as a young person, I was always told to be quiet. Nobody would listen to me anyways. Today, I tell my children to speak up and let their voices be heard. It's really great to hear.
May I say one thing?
Yes, absolutely.
Okay, so I have a little brother, and I found myself basically giving him the information that I was told, so learned behavior, and I was basically just pushing it off on him. So he was 4, and I'll never forget, he fell. And I said, you're a big boy. Big boys don't cry. Get up. And then I thought about it. It's like I had an aha moment. And I said, well, I was thinking, I said, I do not want him to go through what I've gone through. I want him to be able to vocalize like how he's feeling. So now I tell him, I said, okay, cry. If you feel bad, you feel in pain or whatever the case may be, cry. But just know that just do not let that pain or your tears stop you from doing what you have to do. So I think it's one of them things, even when it comes to communicating with the next generation, we have to have that open space. We have to allow room for them to communicate and come into their own, if that makes sense.
That's awesome. Thank you so much, Ms. Lewis. And Ms. Thalia Giglia says thank you, and that it was a nice presentation. So thank you so much for your time and your knowledge. Alrighty. Next, we will welcome our next guest at the roundtable. Dr. GiShawn Mance is an associate professor here at Howard University, an RCMI researcher, and a licensed clinical psychologist. Please join me in welcoming Dr. Mance to the roundtable as she shares her research on youth mental health and her experiences as a clinician during and after the pandemic.
All right, good evening, everyone. Thank you so much for having me. And I wanted to start this presentation. I entitled "The Other Side of COVID-19," and really wanted to focus on youth mental health. And kind of before I begin to kind of talk about the effects of COVID on youth mental health, I wanted to kind of talk about just youth mental health in general, and just essentially kind of where they are, what their needs are, and how they function, and different stressors and how those stressors may impact them. One of the things I believe that we can all agree upon, and when we kind of think about COVID-19 and the pandemic, it is an experience that we all had together, but we experienced it in very different ways. And I remember hearing people say it was the great equalizer and we're all in the same storm. But I also recall telling when I was on different panels, we're in the same storm, but we don't have the same boat. Some people over there on a yacht, and some people are in a rowboat, and some people on kayaks, some people just trying to stay afloat. So, but the equalizing part about it is that everyone could be impacted. The level and extent in which we're impacted may vary. But one of the populations I definitely want us to pay attention to are youth mental health, because we're seeing the numbers. Not only did the numbers, there was an upsurge in services during the pandemic or in the height of COVID-19, but we're seeing an even bigger increase, as it relates to coming, quote unquote, coming out of the pandemic. And someone says, and yes, some people are drowning. Absolutely. Some were barely staying afloat and some were actually drowning. And the reality is that on the other side of it, some people say, we'll see you on the other side. We didn't see them on the other side. That's the reality of that. And that's personal for me, of folks who I thought I would see on the other side and I did not see on the other side. So the reality is that we all experienced something that was out of our control, that put on a level of stress that we have never experienced before. And we were all expected to somehow survive, right? So this notion of like, now we're coming out of it, and how do I go from survival mode to thriving, is one in which our youth are facing and asking and really kind of calling out and asking for help. First slide, please. So this presentation, I'm going to explore some environmental stressors and also discuss race-based stress as it relates to mental health and specifically for Black youth. Because one of the things that we know when we kind of think about the pandemic, when we talk about people of color, particularly Black youth and Black people, we tend to kind of identify two pandemics. One being the COVID-19 and the other being structural racism, right? Ongoing in the existence of kind of experiencing these two pandemics at the same time, and being the height of the political and racial unrest at that time. Next slide. So these are just some images of kind of thinking about the racial injustices in the pandemic, and specifically the racial disparity in regards to COVID-19, whether it's access to health disparities, deaths, and as it relates to just the various experiences during the pandemic, right? Whether it was fear, whether it was anger, whether it's frustration, we can all say that 2020, particularly May, June, July, August of 2020, with the height of protesting, George Floyd, Breonna Taylor, Ahmaud Arbery happened in February, going right into March. It was at the height. And then here's this virus that we've never heard of, didn't know what to expect, and seeing people die, right? So it really impacted it. When we think about youth, is a primary time of development where they need consistency and where they are looking for their adults to kind of anchor them, if they will, while they are exploring. And in the midst of that, their anchor was essentially trying to stay afloat. Some were drowning, and life was unpredictable, which was scary. And so trying to figure out their emotions in the midst of this pivotal developmental period for them was very frustrating. And in my private practice, I had a lot of people, parents calling, asking for services for the adolescent. And the change was essentially, before the pandemic, it would be a lot of parents coming, asking for services and kind of dragging their child along with them, saying, I really want my child to have services. But during the height of the pandemic, it was the youth saying, I really need this. I really want services. But there were ups and downs in it, right? For some people who kind of telepsychology or telehealth kind of changing the game, even though it was in existence before, kind of changing the game in regards to access. But then those who did not have access to Wi-Fi, who didn't have stable connections, it wasn't necessarily, while it provided a different modem of services for some, the field stayed the same for others. but the need was higher. Next slide. So I often like to ask people, how are you? And I think they're going to have a poll that's going to pop up for you, and you can just kind of put in a response of, how are you? Feel free to answer that in any way that you feel that you want to. I'm not sure if people are able to complete it or not, if they're able to respond. If you're not able to respond on the poll, then perhaps you can put in the chat. And the reason why I asked, well, no one responded, so I'm going to assume that, well, on my end, I can't see if anyone responded in regards to how are you? How are you? And I used to ask that question more than once. How are you? Thank you, Lonnisha. She said nervous. So the reason and rationale for that question is that a lot of times we ask that question, but we don't wait for the response. And I'm still waiting for the response. And no one, thank you, excited, thank you. I'm looking at the chat, fatigue, thank you. So a lot of times when I kind of hear people ask that question, how are you? Sometimes I hear folks say, I feel some kind of way. And it's similar to what Sherelle just stated, is I am not sure. Or it kind of reminiscent of, I have so many emotions, I'm overwhelmed. I don't really quite have the words for it, but I know I feel something, right? And so that's the notion of I feel some kind of way, right? So, and it could be frustration, worry, grief, anger, could be a number of different emotions, but we know that the emotions are there. Someone said good, very busy, some pressure, but also excited and tired. Okay. Next slide. So here during this talk, I would like to kind of create some space where this is your time. I want you to take up space. So meaning if you have questions or things that you want to share, then just kind of use the space as needed, right? But I am a person, as you can tell, that's interactive. And even though I can't see you, but I can read the chat. So I will respond to you while I'm presenting, but use this time and this space however you need it. So I'm going to create space for you. And sometimes we need people to hold space, meaning we're overwhelmed, there's a lot going on. So in this moment, can you act as a container to hold what I am experiencing? Because I need to share. I don't know what to do with it. So other people may make space for you so they can hold that emotion, be there while you kind of, whether it's vent, download, whatever you need to do. So in this moment, I want you to take up space and use as needed. Next slide. So you've, Miss Lonnisha, she provided some numbers before in regards to mental health by the numbers, but I'm going to share some as well. Next slide. But before I do, I want to ask you, what is known from your perspective? What do you consider as the common cold of mental health, or a common cold of mental disorders? So what are the most common that we tend to, when we have numbers in regards to prevalence rates? You can put it in the chat for anyone who want to respond. Next slide, while we have some people responding. It tends to be anxiety and depression. Thank you, Nolan. And so here are some of the numbers you can see, and this was some layered numbers in 2020, right when we're beginning in the pandemic. So 42.5 million US adults diagnosed with anxiety disorders, 17.3 million US adults are maybe diagnosed with depression, 12 million US adults with PTSD, post-traumatic stress disorder. So when we're thinking about adults, it was roughly 1 in 5 will experience mental illness. So that's at the height of those symptoms, and symptomology may consider lead to some form of impairment. So there's a syndrome of symptoms that is causing impairment that we need treatment. So that's what we mean when we say a mental illness, right? 1 in 20 may experience a serious mental illness. Serious mental illness, we can kind of identify those as more chronic conditions. And 1 in 5 may experience more substance use disorders and with mental illness. But what about our youth? So when we can look at the numbers for our youth, we can see, next slide. 1 in 5 children between the ages of 13 and 18 have or will have a serious mental illness. And 50% of all lifetime cases of mental illness will begin by the age of 14. Suicide is considered the third leading cause of death in youth ages 10 to 24. And 90% of those who die by suicide, or as a lot of young people say, unalive themselves, tend to have an underlying mental illness. Next slide. So we begin to kind of think about youth mental health in the community, and we're having a sense of community and why that is important. And so one of the big changes for an adolescent during the height of COVID was essentially this form of kind of being in a time, in a sense, where in your development, being around your peers, that they are almost like your center. So you've moved from the adults in your life being the center to really being your social interactions, your social relationships with your peers in that period of development. And you go from one day life being predictable into the next, that being in a sense of isolation. And although this generation definitely use social media in a way that Gen Zers use social media definitely in a different way than millennials. And clearly millennials use social media in a very different way than Gen Xers. And Gen Xers use it in a very different way than the baby boomers, right? So although there's a sense of interaction, that in-person social engagement was essentially had changed, where some were kind of transitioning to environments that weren't necessarily safe, but now everybody's on lockdown. And so we saw the spike in numbers when it came to child abuse and neglect, saw the spike in numbers in interpersonal violence in the homes. So there was this wave of challenges, of mental health challenges, and particularly for youth who may have had, who were neurodivergent or had different learning needs, being able to kind of adjust to dealing with the screen and kind of learning from that when they need very different modes of learning. So again, a lot of stressors. Next slide. So this is just some of the data that was shared earlier, that 30%, when we think about youth mental health, during this time, they experienced poor mental health during COVID-19, and 44% experienced persistent feelings of sadness and hopelessness during the past 12 months when the data was collected from the CDC during the height of COVID. Next slide. So just for you, I kind of want to know, what emotion word do you best describes your experience during the COVID-19? And there are a myriad of emotions. There are compounding of emotions. But if you have to think about and you reflect during that time, during that three-year period, what word or words kind of capture what you experience? Please put that in the poll or put it in the chat. And while we're waiting for people to respond to the poll or in the chat, next slide, please. So taking a look at the numbers, one person said anxiety, overwhelm, anger, stress, grief. Yes, all of that. We're looking, taking a look here with some of the challenges the youth encountered. 55% reported they experienced emotional abuse by their parent. These are the same numbers that Ms. Lewis presented. 11% reported experience of physical abuse by a parent or guardian. 29% reported a parent or other adult in their life kind of lost their home or lost their job. So essentially the parental stressors. Next slide, please. Let's see if I can share the results of your, okay. I was trying to stop sharing. So what I want to kind of transition now is, okay. I want to transition now to building networks for healing, a project, the research project that essentially I'm engaging in through my funding with RCMI and through the work with various communities. And one of the reasons that I feel like this is really important to really express this, because we began to kind of look at community and university partnerships to address kind of trauma and race-based stress for Black youth. That's the basis of the research. But I do want to kind of connect the feelings and emotions that I'm seeing: helplessness, anxiety, asthma, depression, all of the kind of emotions that have been shared in the chat, to the connection of what our youth are experiencing, what the youth have experienced and are currently experiencing. And so I kind of want to start off with how these stressors can impact, how they impact executive function, how they impact the way that we process our cognitive processing, and then in turn our behaviors. So moving into the research, thank you. I want to highlight for you, as we're talking about this type of research, is the representation. It used a community-based participatory approach, which I will define later on. But the essence of that is really engaging the community, partnering with the community so that the community can have a voice at the table. Not only a voice at the table, but an active role in the research process, right? Regulation, it was IRB approved. That's the Institutional Review Board. Each university or institution will have a review board that is making sure that this study is maintaining proper ethics and is conducted in an ethical way. And the rigor of the research that would be presented to you, I kind of think about this as, does it represent what is real? And I feel that I can highlight that as we talk about our advisory boards and making sure, again, how do we contextualize the data? We have the numbers, but what does it mean? And then I'll highlight the relevance. Next slide. So defining CBPR, or community-based participatory research, is collaborative. It is an approach. A lot of times people think of this as a methodology, but it is an approach to research. And the idea is that it begins with a research topic of importance to the community with the aim of combining the knowledge and action for social change. So the idea is that this approach to research will improve community health and eliminate health disparities or reduce health disparities. Next slide. So essential to defining CBPR is the partnership and participation. So for me, that kind of goes back to that rigor and representation. So it's a systemic investigation of a topic of importance. And then the action component is making sure we have this research, we have the findings. Now, what are we going to do with it? Next slide. This was a paper that focused on environmental stress and socioeconomic status. And I think I want to highlight this and kind of connect it to this discussion related to COVID-19, because one of the things that this paper did was that it really kind of highlighted how parental stress and adolescent stress, how it may act as almost like a mediator, or how it may explain any differences between executive functioning, so how you order your world to be able to execute and get things done, and one's socioeconomic status. And this is really important because we think about the stressors and the parental stress, the parental stress, and how, based on those numbers from the CDC, how it impacted the youth. And so based on what this research, and this was done prior to COVID, it was essentially saying that the parent stress was directly related to adolescent stress. And the adolescent stress was directly related to behavior components of executive functioning. And executive function is an umbrella term when we kind of think about how we process information, organize information in order to get things done, how we take in information from our world, organize it in our brain, so then we can then execute and get things done, right? So how do I organize a task to make sure I get my homework done, or get any papers that I'm doing, or lectures that I'm doing, or my day-to-day activities? How do I organize to make sure I don't lose things, that I keep things ordered, that I am able to process information and get things done? Next slide. So one of the things that's really important, because it really highlighted for us in the period of adolescence, how environmental stress can impact the adolescents. Keep going with the, thank you. And so the idea is that when we kind of think about these acute and chronic stressors, we think acute stressors is kind of being the more immediate stressors, and chronic stressors being ongoing. So COVID-19 started as an acute stressor and then kind of kept going and going and going, so it added more of the chronic stressors, which may be poverty strain, exposure to whether exposure to violence, exposure to different types of environments for some youth, that's essentially heightened their levels of stress. So it also what it also provided, when we think about environmental stress, there's some environments that may be chronic, uncontrollable stress, which then may increase the way they the youth may identify their social threats, different social threats around them. So again, although adolescence is already marked by a lot of social, emotional, and physical changes, and then if you have the environmental stressors that may be compounding some of those stressors for youth. Next slide. Correct, and the stressors have not stopped. They have not stopped. And then for youth who are living in an urban environment, an urban context, and essentially, I want to be very specific in how I'm defining that, because in urban context, Howard is within, or DC is an urban context, right? So, but there's different communities within the urban context. So it is a city, it's a lot of noise, a lot of action, a lot of stimuli. But then there's beyond the urban context, within it, there may be underserved, under-resourced, or where the income may be of lower incomes within that those particular different communities. So kind of linking those different stressors. And so not only those proximal stressors and experiences that one may have, so those daily hassles and stressors that one may have, but also the systemic stressors. And this is really important when we're talking about Black, Indigenous, or people of color, when we're thinking about those youth, because we have systemic racism, we have discrimination, we have microaggressions, macroaggressions that they are also continuing with, and all of this while trying to process and make sense of their worlds. That's the executive processing piece. Next slide. So in our brain, we do respond to stress in very different ways, right? So we take in the information. So our brain is processing where the stress starts. They detect the information. The hypothalamus is telling us to prepare for fight or flight. Then the hippocampus is essentially kind of anticipating what will happen and kind of retrieving past memories to say, I wasn't safe back then, is informing me of what I should do now, and the amygdala, how I should feel about it. And the prefrontal cortex is the brain CEO of I need a plan to respond to the stress. So am I going to fight, flight, freeze, or even flop? Next slide. So here, the fight, flight, freeze, or flop, we're kind of thinking about these calming thoughts and feelings when we have these stressors, because our brain is designed to look out for danger and to protect us. And so when we're kind of thinking about the research in different trauma effects, and I'm going to go right in and kind of talk about trauma, because for some youth, what happened, big T, little t, when I talk about trauma, big T, little t. Big T, when we think about big T, maybe some of the life-threatening experiences that one may have that is a threat to their sense of self, their well-being, their safety, or their caretaker's sense of self well-being, to their threat to their life, right? So we think of those as big T. Small T's are those very critical experiences that may put lasting effects, that may also impact their sense of safety, well-being, and care. And so the meaning, how a child may make meaning of that experience, can kind of leave, you can kind of look at it as kind of leaving a symbolic kind of scar. And so kind of looking at it as big T, little t's, right? So for some youth, going through this experience of COVID was traumatic for them. And we kind of think of these experiences of kind of having an impact on the brain. Next slide. So essentially, when we think about the impact it has on their executive functioning and how they make sense of their world, what we find is that the research has kind of linked this early exposure to different types of chronic stressors and changes, even to how in different structures of the brain, it kind of alters the brain structure. So when we kind of think about how it impacts executive functioning, then there's a link between executive functioning and the reward system in adolescence. A lot of times we see poor executive functioning and impulsivity in adolescence, kind of predicting kind of risky types of behavior. So it's really important for us to know how this level of stress may impact executive functioning, and in turn, how the context in which a youth lives, how that may then also compound and inform their executive functioning, and how they're able to whether engage in those behavior components of executive function. Based on this research, we found that the parental stress and environmental stress impact those behavioral components. So shifting from one task to the other, and also mood and affect regulation. Next slide. And we kind of look at this from a Bronfenbrenner model. It's this nested model of essentially kind of this interdependence of the parent stress impacting the adolescent stress, which in turn impacting their executive functioning. Next slide, please. So I'm going to move in and with the time, I want to be mindful of our time of the current study that we're conducting. This was a paper that was deeply rooted, looking at historically Black colleges, so Howard, in our community partnerships, and highlighting environmental stressors and trauma among Black youth. Next slide. So one of the things for this research, we really highlighted representation, highlighted regulation, highlighted rigor, and made it relevant. We want to make sure that the questions that we're asking were relevant to the population we wish to serve, and that we're building an intervention. Essentially, it will be an intervention to address trauma community, so trauma in the community, and so that it can be more of a narrative intervention where the person is how they're defining themselves and their sense of identity, that they are not centering the trauma, but the trauma becomes the periphery, and they're centering their sense of who they are and being more aware of their mental health. So we're doing that from a narrative perspective. So next slide. So just very quickly, when we kind of think about the aspect of representation and rigor from this, the 6 R's of research, the CBPR principles kind of look at the community as the unit of identity. I'm partnering with the community. I'm building on their strengths and the resources within the community. I'm identifying that there are strengths and resources in the community and building upon them, and facilitating a collaborative and equitable partnership in all phases of the research. So there's a co-learning process that takes place, and it's capacity building. The community has a level of expertise and knowledge, and I have a level of knowledge that I'm coming to the table, and we're building and we're integrating and achieving this balance between research and action, right? It's mutually beneficial. That's the concept, that's the principle, this is mutually beneficial. And it emphasizes local relevance from a public health problem or ecological perspective. Next slide. It's also very cyclical and an iterative process. So we're constantly kind of going back, we're assessing it and we're adjusting what's working, what's not working, and we're constantly kind of checking in. And ultimately, we're going to disseminate the findings so that it could be useful, and that we have the information, give it back to our partners so that it can be useful for them as well to, again, engage in capacity building. Next slide. And it's a long-term process and commitment. Next slide. So really some very important concepts is that there's this synergy, and that we engage in cultural humility to really understand that when we come to this table, we have to understand that there's the humility of what you don't know. You know what you know, but then also the humility to understand there's a lot that you don't know. And so allow that conversation in the room. Next slide. So again, there's community involvement in all stages. So even down to when we kind of think about the regulation. So in the IRB aspect, so there's informed consent, the survey and the questionnaires, the engagement, the location, where it's even located. So this particular study was 2-phase study. Phase 1 was essentially survey questionnaire data being collected, and phase 2 was engaging a youth advisory board and a community advisory board. That the community advisory board consisted of adults and emerging adults who either are parents or either working with children or the youth or even service providers. And the youth advisory board are the youth in wards 7 and 8, anywhere between the ages of 16 to 21, who are either enrolled in schools or not, or receiving services from some of these various organizations that we partner with. And so we want to just kind of get the voice of the youth. And so there was a survey component of really looking at environmental stressors, acute and chronic stressors, coping strategies, social support, and then also symptoms, anxiety, depression, and trauma symptoms. And just kind of looking at the relationship of the symptoms, the relationship of these variables for the youth. That was based through questionnaire. And then the second component of phase 2 was essentially the development of these advisory boards. The next slide. So the combination of kind of why Howard and engaging with Howard is kind of thinking about the mission of Howard is really kind of identifying this experience of the kind of emphasis on the opportunities for Black students. And I see like I have a hand. Do I take questions now or a hand is raised?
Yes, feel free to take questions now if you'd like.
Okay.
Let's see, was that Ms. Karen Parker? If you would like, you could come on mic and ask your question.
Thank you. Hi, Dr. Mance. Thank you very much.
Right.
I'm part of the CEC team, but you had mentioned a couple of things, and I don't want to derail your talk, but I wanted to know what you meant by affect. You had mentioned affect prior in the conversation, and I thought I've never really known what that means, especially in terms of, you're discussing what's going on with youth and how their executive functioning is not necessarily always there. So I was wondering what that means.
So when we think about, mood and affect. So when we think about the mood is essentially how a person, how they characterize how they are feeling in that particular moment, or over, let's say, the past week, how has your mood have been? My mood has been kind of, it's been pretty stable, or it's kind of been kind of where my mood has essentially been kind of flat, or not necessarily engaged. I've been kind of sad or frustrated. So that's my mood. My affect is essentially how others can essentially kind of perceive how you are emoting, or how they are kind of reading how you are feeling. So what's your general affect? Are you more of kind of a flat affect, or are you kind of happy and you're able to display it? So their ability to be able to modulate or regulate not only their mood, but their affect is essentially their expression of that emotion. Thank you for that question.
Yes, ma'am. If I can, I'd like to ask another one as well. I'd written down too. You also mentioned, like I said, poor executive functioning that yields making risky behavior decisions. And I'm wondering if that's kind of exemplary of what we're seeing now, with what looks like an uptick of this risky decision making with youth sort of carjacking and things of that nature. Is that what you're alluding to? I guess that would be in the extreme, right?
I want to make sure I understand your question. So can you repeat that one more time?
So I was taking notes while you were talking, and you mentioned the poor executive functioning sometimes yields making risky behavioral decisions.
Yes.
So I was wondering if that might be echoed in what we're seeing in an uptick, especially in the center of the city. I live in the city. An increase of dangerous crimes that are committed by youth, like carjacking and things of that nature, picking on people, like roving around in vans and kind of attacking people. Is that what we're talking about as an example?
Well, you can kind of think about it, because executive functioning, a lot of times, it's an umbrella term, right? It's used quite often as an umbrella term. So it's more specific and more detailed, but it really, when we think about, so you may have heard the term neurodivergent, right? So that means that essentially the way that you process information may be a bit different, or the way that you are able to hold information, or your capacity or bandwidth to be able to problem solve, and how you problem solve maybe it just may be different, and not necessarily traditionally how it's been studied or not just understood, but just say studied or expected. And so when we think about executive functioning, so it may be a person that may have they may be more impulsive in their responses. And so not being very contemplative, but they may kind of be impulsive. And so here's the tricky part, because adolescence is marked by that as well, right? Being more impulsive, because their brains are still developing, right? So they're still kind of trying to understand how to problem solve, regulate their emotions, and things of that nature. So it's not only their brain still developing, but then kind of add in the hormone levels as well that's kind of fluctuating and impacting their behaviors as well. So I don't necessarily want to jump from one's ability to how they are able to regulate or modulate their impulsivity, their affect and mood, to acts of what has traditionally been called acts of deviance or delinquency, for lack of a better word. I'm sure there's a better word for that. But then that type of behavior, could there be some overlap? Absolutely. But I don't want necessarily say that one is essentially kind of explaining or causing the other. But they're absolutely, based on when we kind of understand and peel back the layers. Individuals who are engaging in that type of activity, are their concerns related to executive functioning? Probably, but then also, are their concerns related to trauma? Their history of trauma, has there been a history? So Ms. Lewis talked about childhood experiences. So that's adverse childhood experiences, ACEs. So there's research that kind of talk about what that number of ACEs increases, that makes you more vulnerable, if you will, to different types of to stressors, and in turn make you more vulnerable to, let's say, depression, PTSD, anxiety, right? And so it may be when we're scaling, we're looking back for those individuals who are engaging in that behavior, carjackings and things like that. It's multi-layered, right? And has it impacted executive function, their ability, and how they modulate and regulate? Yeah, probably. But we also have to understand the other factors that are informing that as well. Thank you for those questions. That's great. I'm going to try and wrap up because I want to make sure that Nolan Carr has time. So can we, next slide? So I'm just going to go over the objectives, and then I'm just going to go straight to the end. So the objective of the study is essentially, ultimately, is to design a contextually relevant intervention that will sustain and build networks for youth and help them to address acute and chronic stressors, traumatic stress, and coping resources for youth who live in an urban environment. I'll keep going. So first, we assess the stressors. And these are some of the stressors: major events, daily hassles, exposure to violence, poverty, strain, traumatic experiences. And the next slide. Then we determine how these stressors are functioning, any influence that support systems are having. And we also kind of look at the presence of trauma symptomology. And then lastly, where the other aim is to build a youth advisory board and community advisory board to really contextualize the results. We do the statistical analyses, we have the findings. Now, what do they mean? Next slide. So this is just kind of talk about the compounded effects of traumatic stress and mental health, which I've stated earlier. So I'm just going to keep going to make sure that we can get to our next speaker. We keep going. So one of the things, this was one of our project, our CAB members. And so I have a picture here because it's important to have different members of the community who are present at the table, have a voice who's doing the work. Next slide. And we also want to move beyond the ivory tower, beyond academia, beyond using collecting the data for research journals. So we want to make sure that we are addressing the needs of those who we're serving, societal changes, and mental health. Next slide. So a youth advisory board, they were recruited by teachers. We partnered with 3 schools. They were based on teacher recommendations. Then we had an informational call session. We got parental consent, student assent. They agreed to attend the meetings. And then we began to partner with different community advocacy organizations. Next slide. Data collection was in a neutral location, sometimes at Howard, sometimes at other locations. They were bi-monthly meetings for the CAPs were held at Howard University. Next slide. We had 2 sessions and we asked different questions about so one was a welcome orientation, and session 2 was identifying stressors. What is stress? Are you familiar with stress? Things of that nature. Next slide. In the CAB, we had 2 sessions asking about their mental health. One was a welcome and the other one was mental health services, what's the most common mental health issues with the youth that you serve, what mental health services are available, what solutions that you advise to address these barriers to mental health for DC and youth, and just to kind of get, again, focus group getting this information from their experiences. Next slide. Again, that's going back to the rigor representation of those 6 R's of research. Based on our qualitative data analysis of the 2 groups, we're only able to run two groups and get this data before COVID hit. And so some of the themes for the Youth Advisory Board was financial strain as it relates to violence and the lack of resources in the community. It said nothing to do here is just trouble. You don't see all of that in other neighborhoods. Then there's also the theme of anger. I don't know how to express my stress without being like violent or like always arguing. And then it was the theme of loss. It is what it is. Shootings happen. Next slide. Some of the themes for the community advisory boards was essentially trauma. And they said trauma events become a community event. So services that address trauma are not adequate. They are either not long enough, not comprehensive enough, and delivery is not relevant. The last one was how do we engage with youth, and they have the history of trauma. You have to build connection. They have to know that you are authentic. You have to shift from distant to connection. They have to legit believe you are there for them. It comes down to trust, and you have to earn it. Next slide. And lastly, trust and sustainability. Some of the students are in survival mode. They will try to finesse you because it is about survival. They will try to get what they can because they are not sure what the opportunity will present itself again. Fundamentally, this is a trust issue. Can I trust that my needs will be met? And these are the themes that we were seeing prior to COVID. Research is a winding road, keep going. So what will end up happening, COVID shut down everything, but now we're up and going and the journey continues, keep going. And now we're engaging with RCMI as funding. We're doing the mixed methods designed again, back to recommitting to our advisory board and engaging. So we're back in phase 1 and phase 2 again. Next slide. So this is just ways to kind of get involved with the research. I'm sure you can email the research core and they can give this information as well. But this is essentially ways in which you can be either a community advisory board member, or if you know youth that might be good, interested in kind of giving their voice to their experience, they can join our youth advisory board. Or if you just want to complete the survey, in the middle, there's a QR code to go straight to the survey to complete it. I'm going to stop there. There's other slides related to our Emerging While Black study. And that study essentially, when this network project was essentially placed on hold because of COVID, we began to ask questions about race-related stress and cultural coping and symptoms for Black emerging adults, so ages 18 to around 25, in the height of those 2 pandemics. And so we did some research on that, but because due to time, and I want to yield the floor to my colleague to make sure that they have time, I'm going to stop there.
Thank you so much, Dr. Mance, for that fantastic presentation. Right before we jump to Mr. Carr, I do want to give just a few minutes of space for any questions and comments that people might have. So we'll take about a minute break just to process and share anything that anyone would like to share. I see that there are some people who are interested in the research study, so we'll be sure to send all this information in our follow-up email along with the resources that will be mentioned tonight.
One more thing, if time permits, towards the end of this presentation, I did have 2 coping strategies that I wanted to do collectively if our time permits. If not, then that's not a problem. That's not a problem at all. It's the coping strategies. Oh, but I want to yield the floor to my colleague, and then we can kind of circle back if time permits.
Okay, absolutely. We can do this at the end after Mr. Carr. We'll just take one moment for a quick break. Alrighty, let's return and welcome our final speaker, Mr. Nolan Carr. Mr. Carr serves as the Community Relations Manager for Amerigroup DC. He has worked with at-risk youth, as well as a mental health and wellness advocate. And so welcome, Mr. Carr. We're very glad that you're here to join us.
Thanks so much. It's great to be here with you all. I'm super appreciative from the presentation from Dr. Mance and Ms. Lewis. And, as mentioned, my name is Nolan Carr. I work with the Amerigroup DC, which is a managed care organization here in DC. And we have a big focus on making sure folks throughout the district are healthy and integrating care. And putting an emphasis not only on physical health and dental health, but making sure that we're addressing behavioral health and mental health and wellness as well. So we have a group of staff at Amerigroup DC, at our managed care organization, at our health plan, that are really supporting young folks and folks who work with young folks to make sure that we're providing resources to those who may be dealing with any trauma, as many of us are, and trying to cope with things and find their ways to well-being. So we do a lot of different things. We have a case management team that links folks to services. In addition to that, we have a behavioral health case management teams that really works with folks to, make sure they're connected to services such as therapy, and even, teaching things such as the importance of self-care and self-care skills. And so another resource that we have that I kind of wanted to present and speak about as a company, and we're looking forward to bringing to DC, is mental health first aid, and having folks to train folks on that course. And so just to give a little background on mental health first aid, it is a program. And if you're familiar with other programs that support health, not specifically for mental health, but maybe, like CPR, things like that. We need courses and training to help folks deal, and respond to the signs of mental illness. So that's what mental health first aid is. Everybody's pretty much aware of a first aid kit. If you have a cut or a burn or something like that, what do you use? But when folks are dealing with mental health, how do you treat that? Who's trained to help with that? And what is in that kit? So the training gives you the skill and the toolkit you need to reach out and provide help and support to someone who may be developing mental health or substance abuse problems or experiencing some type of crisis. So, and on April 1st, we will be officially fully staffed up, and, hope to offer some of these trainings in the future and connect folks to the resources, not just to our trainings, but others that are offered as well. And then we also, hope to get folks trained to offer the trainings. So we're continuing to teach folks and bring awareness, around mental health. We know a lot of times in our communities, speaking about mental health and well-being and services related to it can be a bit of a taboo, or there's some stigma or some miseducation attached to it. So I wanted to, share that overview, and also, if we can go to the next slide, provide a little information around some general inquiries. If you wanted some more information, I'll drop my contact in the chat as well. If you want to connect with me about getting to some of the resources that we, will provide as a health plan around this. But again, a lot of folks aren't, aware of what mental health first aid is, and some other resources. I know that you were provided some earlier in the presentation by Ms. Lewis. So I didn't want to take up a lot of time. I'm very grateful to hear the resources and information that was provided today. Again, I do want to drop, my contact information so we can connect if you have interest in learning more about this and, providing this to folks in the future. I would definitely welcome the opportunity to do so. We've seen some great, outcomes and impact with this program in the past. We've done some training for folks working with young folks who have been dealing with all kind of things from suicidal ideation to deep depression and things like that. And so how do we look for those triggers? How do we support them? And then linking them to other services such as the National Alliance of Mental Illness, NAMI. So, I look forward to connecting with you all. I know we have some more time left. I am looking forward to, hearing back from Dr. Mance. So if you don't mind, I'd like to kick it back over to her. And again, I'll drop both my email and a number to reach me in the chat to connect further about this mental health first aid. So nice seeing you all. And I'll give it back over to the host so we can get some more information from Dr. Mance.
Thank you so much, Mr. Carr. We are definitely thankful for the introduction to what mental health first aid is, and as well as resources. Again, we will have all of this in our follow-up email, as well as Mr. Carr's information. We highly encourage you to explore mental health first aid training, and if available, take part in it. And I'll hand it over back to Dr. Mance with our coping strategies.
Thank you. Can you go back one more slide? So this part is going to be, I guess, somewhat interactive. It's going to be participatory. So for people to participate. So we kind of think about different coping strategies, and with the increase in need for mental health services is one of the reasons why, as the director of clinical training at our clinical doctoral program here at Howard, I reiterate over and over to our students that you are needed. When we think about clinicians in general, but specifically clinicians of color, there's a need. You are needed, and how you disseminate the information, whether it's with going into different communities and you're doing workshops, whether it's one-on-one therapy, thinking of very different and creative ways of how you disseminate information. A lot of clinicians are using social media, doing quick TikToks and different videos just to make the information accessible, right? So it's a sense of how do we build awareness around mental health, but not only do we after you have the awareness, what are some strategies? And for our young people, just kind of giving them some strategies, kind of like on the go, some things that they can kind of be aware of and use. And so I'm just going to share 2 strategies tonight that you can either share with young people or practice with them or even do yourself. And they're more contemplative strategies, kind of using this concept of kind of mindfulness, being in the moment, particularly if you kind of think about the different experiences, whether it's anticipatory anxiety, kind of we're having this anxiety about what we are anticipating that will or will not happen, or feeling like this sense of we don't have a lot of control. And so there's anxiety about what may kind of unfold. Or just kind of times where, because things that have happened in the past, there may be different things that may trigger events or stimuli around you that can kind of take you back to that place. And so how do you ground yourself to be in the moment so that you feel like you have some type of sense of control? And so one is a grounding technique. So if you all can kind of get yourself comfortable, whether you sit back, sit up, put your feet flat on the floor, I'm just going to ask if you could just kind of take a deep breath in, hold for 4, and slowly out for 4. 1, 2, 3, 4. And one more time, take a deep breath in, hold, and slowly out. One more, take a deep breath in, hold it, and slowly release. 1, 2, 3, 4. Sometimes we just need to kind of do a quick reset with our nervous system. Like we're taking in a lot of information. kind of responding to the world and our stimuli. And so sometimes it's helpful just to do some deep breathing, and doing it with your eyes closed also helps to kind of do like a reset, if you will, of your nervous system. But then also kind of grounding yourself and being in the moment. I want you to kind of identify 5 things you can see. So just look around your room and just notice 5 things you can see. So for me, see my computer, see the door. I see a chair across the way. I see a bubble machine for my 4-year-old. And I see a bottle of water. What are the 5 things that you see around you? Now notice 4 things that you can feel. What do you feel? My hands are on my legs, so I feel my texture of my pants. I feel my back up against the chair. I feel my foot in my shoe, feeling tight. And I also feel a piece of hair on my face. So what are 4 things that you feel? What are 3 things that you can hear now? Even though it's warm outside, it's cold in my basement, I have a space heater, I can hear that. Surprisingly, it's quiet and I don't hear my kids, so I hear silence. And what other things I can hear? The light, the beams from the lights. 2 things that you can smell, and 1 thing you can taste. What do you taste? And these are the times you can do what you just need to reset. You need to ground yourself. So whether you kind of find yourself kind of going in the past and you need to ground yourself, or there's some anxiety about anticipating what might happen. Next slide. Some other strategies, coping strategies: go outside, walk around. If there's a garden, sometimes there are community gardens you can go to. Sometimes cleaning and reorganizing can help. Feeling like a lot of times our outer space can reflect how we feel inside. So if there's a lot of clutter around you, you may be feeling cluttered inside. So sometimes organizing can help. There's some free apps. Calm is a free app. Virtual Hope Box. Liberate. That's a very good app, specifically geared towards BIPOC populations, Black conditions, people of color, and really kind of talking about whether it's anti-racism or just they're just mental health and different sources for mental health. And then Shine is another app, and all these are free apps that you can use to kind of help. Here are some other grounding techniques, but also another strategy is visualization. And so I'm going to collectively take you through a visualization if our time allows. And then that would be it for today. So if you can trust me for a bit, I want you to, again, make yourself comfortable. Take a deep breath in, hold, and exhale it out. Another deep breath in, hold, and breathe out. Now I'd like for you to close your eyes. Allow yourself to get comfortable. Couple few more slow, deep breaths in through your nose and out through your mouth. Let your body get relaxed. If you're sitting in a chair, let the chair fully support you, and as your body continues to breathe and relax. Now I want you to use your imagination to picture yourself walking slowly along a path. It's a pleasant path, any kind that you wish. It's a beautiful day, and you feel relaxed and happy. You feel the warmth and the energy of the sunlight on your skin. Soon you come to a gate. You know this gate leads to a special place where you feel welcome, safe, and comfortable. I want you to push that gate open and allow yourself to enter into your very own private garden. Your garden is filled with your favorite things. Whatever is pleasing to you can be found in this place. Perhaps there are flowers or trees, animals, birds, or even music. Look around and notice what is in your garden. I want you to see all the colors and the objects that are in this place. Notice how beautiful they are. Look at the various shapes and see how varied they are. Look at the ground. Look at the sky. See where they meet. Your garden is calm. Everything peacefully coexists in this garden. And as you are looking, you become aware of how things feel in this private place of yours. I want you to begin to explore this place with your senses, with your sense of touch. Perhaps something is soft and warm, while others are smooth and cool. Spend time exploring with your sense of touch. Notice how the air feels. Take time to feel the peace and serenity in this private place. As you continue to explore your garden by seeing and feeling, become aware of the sounds in your garden. Are they pleasing to the ear? Are they comforting? Is it quiet? Some of the sounds may be soft, while others may be louder. Just relax and listen for a while. Identify the different sounds. Take a deep breath in. Notice the fragrances in the garden. Are they pleasant and soothing? Enjoy your garden. Spend time that is necessary for you to rejuvenate and to care for yourself. When you are ready to leave, I want you to slowly walk back towards the gate of your garden. You have enjoyed the visit of your garden and you feel relaxed. This good feeling will remain with you throughout the day. Push the gate open and return to the path that led you to the garden. As you make your way back to that path, to the here and now, remember that you can use your imagination and return to your private garden at any time you wish. Visit at any time you would like to relax and to be comforted and enjoy the beauty. Stretch gently, open your eyes, feeling refreshed and alert. Thank you for enjoying your private garden. In any moment when you need to take care of yourself, you need to take care of a teen or a youth, allow them to be able to create their garden, their space, a safe space. And in that moment, you can allow yourself to be a safe space by being a sounding board and hear them. A lot of times the young people just want to be heard. They want to utilize those resources for them. Thank you.
Thank you very much, Dr. Mance, for that peaceful practice. We will send these strategies to all of you so you can take it with you beyond tonight's call and share it with your children and your youth. And so we thank each of you. We thank our speakers very much for their wonderful presentations, for sharing their knowledge and their expertise. And we thank our audience for staying with us. I know we've gone over, but thank you very much for staying with us until this time. Before you leave, we do want to share one more thing. So we've talked about the benefit of research tonight and how we can use research to champion our own voices. We actually have a study right here at RCMI CEC. This one is a survey about an hour long, 2 different surveys. And so if you complete every single part of the survey, you're eligible to receive up to $100 in compensation. This study is supported by a grant through the National Institutes of Health for the NIH. And if you have any questions, please feel free to email us at rcmi-cec@howard.edu. We will also put it in the chat. To participate, please save the link that will be posted in the chat shortly. Again, it will also be in our follow-up email with everything that we mentioned tonight. So I'll hand it over to Kristen to close us off.
Thank you, Elisha. And thank you so much to everyone on this call for your wonderful participation. We are now at the end of this session. When you leave the call, a very short survey will pop up. Please take a moment to give your feedback. Finally, please follow up with us at rcmi-cec@howard.edu or add your information to the chat to join our mailing list to keep up with our programming. We wish you all a safe and mindful walk. Until next time, good night.